So my name is Jacobo Santa Marta. I'm with the Shift Master team with MSer Reporters at the EMSP 2019, the 30 years anniversary of this conference, and I'm with
Jana, I'm from Czech Republic. I was for 7 years, and now I'm the member of EMSP Executive Committee.
Jana was talking yesterday about digital health, and I wanted to ask you, how do you think digital health and all the new technologies can help people with chronic conditions, especially people with MS?
Oh, I think that the digital tools can be so much help to people with chronic conditions. It might seem a little bit complicated, but actually they are here by experts to help people in various ways to make it easier for us to manage our condition, the MS, easier for the researchers to collect data, easier for the registries to collect data to involve the decision making by, giving the evidence on it. And also, for example, what can be a big use of them is the communication between the patient and the doctor. Having, for example, questionnaires to ask the questions so that you don't have to spend this time, like when you are face to face with the doctor, make the most of the use of your appointments. And like my favorites are the apps, of course, that can manage your health better by motivating you and also making it possible to you to monitor your health as well.
Yeah. Okay. And you was talking yesterday. Someone talked about having a conversation with the neurologist through. For example, a video conference. You think that could be useful? That people could relate to that? People could do that, like instead of going to the neurologist, actually just use the video conference.
Yeah. So,
Do you think that?
first of all, I think we can never fully replace the actual contact, the personal contact with the doctor by this, but it can be very useful. For example, in the countries where it's really hard for you to get to a doctor, meaning first maybe the obstacles are how big the country is, how is the connection, but also the availability of the doctors. Somewhere there are very little number of them, and they are very precious. They're always very precious. So it's important that these technologies, like the mHealth, having the video conversation, can help us actually get to the care, read the doctor, have a conversation, and also while having the appointments, the one-to-one appointments, it's good to have a really good use of the time that we have. So it's very important for us to be checked, to be able to ask questions, the doctor to be able to see and decide together with the patients about the best treatment. So they can be very handy in actually having the access and then making the best use of the time you actually spend with the doctor.
Yeah, that's great. And there's one last question I wanted to ask you. That is about the data collection. How do you think that's going to be useful? That can be useful for people having MS, not only for patients, but obviously for neurologists or for researchers, for people working with people having MS.
Oh yeah, this is my most favorite topic, I think, or one of the most favorite, because it has such a big impact. Data collection has a real impact on the access to care of patients, because first, when you need to decide, when the decision makers are here to decide on the actual access to treatment, how the care is reimbursed, whether what will be the payment for this, so that the care is accessible to patient, you need the data to back your arguments with. You need to know what is the impact on the patient, how effective the treatment is, what is the cost? What will be the budget impact? But also, like, what will you save by introducing the technology? So having people benefiting from the treatment, which will allow them to be active in their life, is very vital. And we now know that some of the regulatory authorities are accepting the real-world data, not only, which is very important, the clinical data, but also the real data, because they can tell you from the real world how the medicine is being effective. We are collecting data on, not only the relapse rates and disease progression, but also about in a time about other factors in life, like, I don't know, the maternity as well, the workability of people. We now, in the Czech Republic, we have quite a robust register. We are very thankful for it. We have 75% of patients covered, like the data are there from the patients, collecting all sets of data that are important, and we can tell like how many people need the treatment, escalated treatment, how they are benefiting, and also like what will be the cost, like the healthcare cost, the social cost. And on this, the decision makers are actually basing their decision making, because we can provide them with these, and it's important that the data are robust, are covering most of the patient, they are safe, and they are reliable. So thanks to the great work of our experts and people like doing it, collecting it, I know they are sometimes doing it in their free time, like we can feed the decision making and the decision makers with the data they can base their decisions on, and to make the care accessible in a good way. Yeah.
Yeah.